Well, the doctor is in. Joining us again on Bloom to discuss preventing coronary disease is cardiologist Dr. Chet Kamari of Premier Heart and Vascular Center. Welcome back, Dr. Kamari. Thank you for joining us again on Bloom.
I'm glad to be here, Carissa.
So we're talking heart disease, we're talking coronary artery disease, and that is the #1 killer of Americans?
Actually, Americans and worldwide, unfortunately.
Wow, okay. So how do we know if we are at risk for this?
So there are definite risk factors and things people need to look out for. The #1 thing, it's a non-modifiable risk factor, is your family history.
Okay.
So when we talk about family history, it's very specific. It's first-degree relatives, meaning mom, dad, siblings. Male less than 55 in your family who has heart disease, or a female less than 65.
Okay.
Put you at significant risk. Second would be our smokers. Third, high blood pressure, patients with high cholesterol.
Does obesity factor into the risk factor for this?
Absolutely. It's a risk factor, but in the sense that most of the people who have the obesity have the high blood pressure or the high cholesterol, so it kind of fits together.
All goes hand in hand. So is this a disease, coronary artery disease, that we can prevent?
Absolutely.
Okay.
So the fundamental treatment for it is lifestyle. Educate them about the healthy diet, exercise, keeping your weight down, all very critically important.
The funny thing is we've talked before about high blood pressure, we're talking about coronary artery disease, and we're saying that there's things you can do. Why don't people do them?
That's my biggest
I know
challenge,
it's a hard
Carissa.
question, but
it really is.
okay.
And, with your nutritional background,
Yeah.
it's easy to educate people, but how do I make it stick?
Yeah.
And I try to attack that's like fear and education and using wives if I can. Any tool at my disposal.
Yeah.
Yes.
But it's still sometimes hard to get through. So if people are out there watching and you're listening, listen and maybe share the message with other people. Be that positive advocate for change.
Absolutely.
Once I am diagnosed with something like heart disease or coronary artery disease, what happens then?
So, the first thing is obviously we have to institute the right medical treatment, okay? Secondly is educate you about the importance of being compliant with that treatment. And third is follow you going forward to make sure that the changes we're implementing are doing what they're supposed to do, you're tolerating them okay, and then you're going to be compliant long term.
Okay, how does cholesterol factor into this equation? Because that's not something we've talked about.
So cholesterol, it's interesting. It's sort of kind of become the holy grail of cardiology in some sense, and we have to tailor that to the patient. So, diabetic patients, for example, I'm very aggressive with cholesterol. If you have known heart disease, very aggressive with cholesterol. Patients that don't have heart disease, we sort of have a gray area, and then we kind of have to talk and do a little deeper digging to see, what I have to do if they need treatment or not.
Yeah. What about diet? Is saturated fat something that you recommend your sort of patients that have heart disease or high cholesterol take out of their diet?
Absolutely. Avoid trans fats, sugary foods and beverages, and then stay away from your fatty red meats.
Okay, good. I agree with you on all of those points. Well done, doctor. All right, let's talk about heart attack. How can I know or someone know if they're having a heart attack?
That's the most important thing I'd like people to take home from this. There's several signs and symptoms. One would be a heaviness or tightness in your chest, a squeezing sensation. Secondly, a more common one I see is burning sensation. People often mistaken for heartburn.
Yep.
If you have it, it's not responding to your antacid. Get to a hospital. Other symptoms can be jaw, arm pain, back pain, and then unexplained nausea or even cold sweats can be a sign.
I have heard that heart attack symptoms in women are different than heart attack symptoms in men, and I want to make sure people know that. So if you're a woman out there, what should you be looking for that's different?
It's so challenging. I've seen so many different presentations of women at times when I was convinced before I got the information that this patient's not having a heart attack, and they are. So for women, I just tell them, listen, it's still more common to have the common symptoms. But if you're having malaise, fatigue, unexplained weight gain, being out of breath, these are all signs of potential heart disease, and you need to get help.
For heart disease, are there any medications that people typically are on to sort of mitigate these symptoms?
Absolutely. So #1 is aspirin, having that blood thinner on board. And then if they have high cholesterol, getting them on what's called a statin drug, which have a lot of research backing for that particular patient population. Beta blockers are medications that are designed to prevent the heart from working too hard if you have heart disease.
If we see someone in a public place having a heart attack, what do we, as a bystander, is there anything we can do to help?
Absolutely. #1 is obviously make sure we get 911 on the phone. Secondly, if you have somebody helping you or somebody's around, get them to go get a defibrillator device in case a patient loses consciousness. And then thirdly, stay with the patient, try to talk to them, keep them calm, relaxed, and don't let your eyes off of them.
All right, well, you have a very calming demeanor, so thank you for that and this great information. If you would like more information on how you can help prevent coronary disease, you can visit Dr. Kamari's website at premierheartandvascular.com. Thank you, Dr. Kamari. Great to have you once again. Stick around. We'll have more Bloom just ahead.